My name is David Hilton-Jones. I run the adult neuromuscular clinic in Oxford. I've had a lifelong interest in neuromuscular disease. We've just completed the Patients' Day for 2016, which was held the day before the annual translational conference. For the last about 8 or 9 years, the translational conference has been organised by MD UK and by the MRC to bring together researchers working in the field of neuromuscular disease to discuss progress in the area. It's called a translational conference because we believe we're getting very close to being able to translate work in the laboratory to work in the clinic. In other words, treatments for neuromuscular disease. Last year, MD UK realised it was a very good opportunity to have a Patients' Day when all the experts on neuromuscular disease were in town. And so today we've arranged a Patients' Day which has been centred around 4 themes or 4 diseases. And the 4 topics that we chose were Charcot-Marie-Tooth disease, Inclusion Body Myositis, facioscapulohumeral muscular dystrophy, and Duchenne muscular dystrophy, but specifically in adult life. And the way we organised the day was to have an introductory talk by Teresina Evangelista from Newcastle, who talked about trial readiness, explaining the importance of having data about patients to instruct us about natural history of the conditions, so that we have information available on patients so that when trials are proposed, we have a cohort of patients ready to undergo study. We then heard from trailblazers from MD UK, and then we divided up into 4 sections to discuss the 4 theme areas, and an expert in each area gave an update on research, which I think patients found extremely informative. We then had a prolonged lunch break when people were able to talk to each other, to talk to the scientists, to talk to the clinicians, to talk to the support groups such as CMT UK, the myositis support group. And I think patients found it very helpful to be able to talk to others and to talk to such groups. And then the afternoon, we again split up into 4 workshops, one covering each disease area. And the content of the workshops varied, but most of it was talking about clinical issues, what we can do now to help patients, what support is available, but also gave a further opportunity to discuss research, for patients to ask questions, and it was done in a very open way so that the patients had the freedom to ask any questions that they liked about the condition that we were dealing with. And talking to patients in those workshops and afterwards, the impression was that they found it extremely helpful to have the opportunity to meet. It was very helpful to have the theme so that people were talking about areas of interest to them rather than generalities. And I think overall it's been an extremely successful day.